5 health checkups you should avoid after 70. Most people grow up believing that regular checkups are the cornerstone of good health. And in many ways, that's true. Early detection has saved countless lives. But what happens when those same checkups start doing more harm than good? After the age of 70, the rules begin to shift. The human body changes, the risks evolve, and the cost-benefit balance of some medical tests starts to lean in the opposite direction. That's why in this video, we're going to talk about 5 health screenings that seniors should think twice about. Not because checkups aren't important, but because sometimes not every test is worth the trouble, especially when the downsides start to outweigh the benefits. Let's start with the one that often feels the most responsible: cancer screenings. Colonoscopies, for example, are often recommended every 10 years starting at age 50, but past 70, or especially 75, the balance begins to shift. A colonoscopy is not a light procedure. It requires sedation, bowel prep, and has risks like internal bleeding, intestinal tears, or adverse reactions to anesthesia. For a healthy 50-year-old, the benefits usually outweigh the risks. But for someone over 70, particularly if they have other chronic conditions, the risk of complications goes up. And if they've had normal colonoscopies in the past, continuing to repeat the test may provide very little additional benefit. Many guidelines, like those from the U.S. Preventive Services Task Force, now recommend stopping routine colon cancer screening at age 75. In some cases, even earlier, especially if the person has a limited life expectancy or frailty. This isn't about giving up, it's about using healthcare more wisely and minimizing avoidable harm. The second checkup to reconsider is prostate cancer screening, especially using the PSA blood test. At first glance, a simple blood test might seem harmless, but the real issue isn't the test itself, it's what comes after. PSA levels can be elevated for reasons other than cancer, such as benign prostatic hyperplasia or infections. That means a slightly high PSA result can trigger a cascade of follow-up procedures. More tests, repeat PSA checks, prostate biopsies, or even treatments like radiation and surgery. These interventions come with serious risks, like urinary incontinence, erectile dysfunction, infections, and unnecessary stress. And here's the hard truth. Prostate cancer in older men often grows so slowly that it never causes problems during their remaining lifetime. Studies have shown that treating it aggressively in older adults doesn't always lead to longer lives, but it can reduce quality of life significantly. That's why many expert panels advise against routine PSA screening in men over 70. It doesn't mean ignoring symptoms. It just means not chasing numbers when there's no real benefit. Now let's talk about mammograms. Breast cancer screening is essential for women in their 40s, 50s, and early 60s. But after 70, especially past 75, the story gets more complicated. Many women in this age group undergo mammograms out of habit or fear, not because of evidence-based necessity. Mammograms, like other screenings, can result in false positives, leading to more imaging, biopsies, anxiety, and sometimes even surgeries for tumors that would have never caused harm. This concept is known as overdiagnosis, finding cancer that's technically there, but slow-growing and non-lethal. The more we screen, the more of these we find. In women with limited life expectancy, frailty, or other major health conditions, the chance that a mammogram will actually prevent death from breast cancer is extremely low. On the other hand, the risks of emotional distress, complications from procedures, and unnecessary treatments go up. For women who are still healthy and active, there may be value in continued screening, but it should be a personal decision made with their doctor, not an automatic routine. Next, we need to discuss bone density scans, also known as DEXA scans. These are used to detect osteoporosis, a condition where the bones become brittle and fragile. Now, this might surprise you, because bone health is incredibly important in old age. But here's the issue. If you've already been diagnosed and are on treatment, repeated scans after age 70 don't usually provide new or useful information. Many people get caught in a loop of testing every year or two, even though their results rarely change. And some medications used for osteoporosis can come with side effects like jaw osteonecrosis or unusual fractures if used long-term. A more practical approach is to focus on fall prevention, physical activity, and nutrition. things that matter more for maintaining real-world bone strength. The scan itself isn't harmful, but repeated testing without a plan for action doesn't make much sense and can lead to unnecessary medication changes or anxiety. And finally, we come to full-body CT scans offered at many private clinics. These are often marketed as ultimate preventive tools, something like a full scan of the body to catch hidden diseases before symptoms appear. But full-body scans expose you to a significant dose of radiation. Not just a little, but often 100 to 200 times more than a chest X-ray. For older adults who are already more vulnerable to the effects of radiation, this poses a real risk. Add to that the high rate of false positives, incidental findings that turn out to be benign but require follow-up MRIs, biopsies, or even surgeries, and it becomes a cycle of stress and danger. The appeal of early detection sounds good, but in practice, these scans often create more problems than they solve. Unless you have specific symptoms or medical history that justifies advanced imaging, these scans are not just unnecessary, they can be harmful. They're also expensive and rarely covered by insurance, which means you could be paying out of pocket for something that ends up causing more harm than peace of mind. At this stage in life, the goal of healthcare should shift from aggressive screening to thoughtful care. The focus should be on quality of life, managing symptoms, and preventing what matters most: falls, infections, heart disease, and cognitive decline. That means not every test is worth doing. Just because something can be checked doesn't mean it should be. Every medical decision carries a trade-off. And after 70, those trade-offs deserve more scrutiny. A test that made perfect sense at 50 might not be smart or safe at 75. Some might say it's better to be safe than sorry, but when safe means more procedures, more risks, and more suffering, we need to ask, safe for whom? And sorry about what? True safety in senior health means avoiding unnecessary interventions and focusing instead on meaningful, personalized care. That's how we preserve dignity, independence, and peace of mind in our later years. There's another layer to this conversation that many people, especially seniors, don't often hear: the emotional toll of over-testing. Every test brings with it not just the possibility of results, but the weight of waiting, worrying, and wondering. For someone over 70, where peace of mind and stability matter more than ever, one ambiguous lab result can lead to weeks of anxiety, dozens of follow-up calls, and sleepless nights. And that's often for conditions that won't even shorten their life or cause real symptoms. It becomes a case of medicine chasing shadows, finding problems that would have never caused harm and causing harm by trying to fix them. Let's also talk about how testing interacts with multiple chronic conditions, something very common in older adults. A 72-year-old may already be dealing with high blood pressure, arthritis, diabetes, or early memory issues. The more conditions you have, the harder it is to interpret new findings accurately. For example, if a scan reveals something questionable in the lungs or liver, but you're already taking 5 to 7 medications daily, the choices around treatment become more complex and riskier. In older bodies, healing takes longer, side effects are more severe, and hospital stays can lead to a rapid decline in independence. A single biopsy might lead to a fall, an infection, or complications that would have never occurred if the test hadn't been done in the first place. It's not about neglecting your health, it's about prioritizing the right kind of care. There's a misconception that skipping a test means you're being careless or giving up, but informed avoidance is not neglect. It's actually one of the most responsible things you can do as a patient. Knowing when to say no is just as important as knowing when to say yes. And that's especially true after age 70, when every decision has a ripple effect on your mobility, energy, and overall well-being. One key concept that doctors often use in these decisions is called life expectancy versus lag time to benefit. Simply put, some screenings take 10 or more years to show their full benefit. If a test is meant to catch something early to prevent death a decade later, but you're already in your late 70s with other conditions, it may not make sense to go through that testing process anymore. Not because you don't value your life, but because you value the quality of your remaining years. That's why the same test that's life-saving at 55 may be unnecessary at 75. But it's not just about age. It's about goals. What are your health priorities now? Are you more concerned with avoiding aggressive interventions? Do you want to stay out of the hospital? Maintain your independence? Keep walking every day without assistance? If that's the case, then your medical care should be shaped around those goals, not around automatic screenings. And here's something else that's not often discussed: the influence of financial incentives in the healthcare system. Many clinics, hospitals, and even insurance plans push regular testing as a default part of annual exams, not because it's always in your best interest, but because it generates revenue. It creates a system where more care is confused with better care. But for older adults, more care can sometimes mean more harm. The most compassionate doctors understand this. They know that for seniors, the best medical care might actually involve doing less, not more. This doesn't mean you stop going to your doctor. It doesn't mean you ignore symptoms or skip important treatments. It means you focus your attention on the care that makes a real difference. Managing blood pressure, keeping cholesterol in check, screening for depression, checking vision and hearing, staying physically active, eating well, and having meaningful conversations about your health goals. These things improve daily life and long-term outcomes far more than routine testing for diseases that may never affect you. If something doesn't feel right, if you're losing weight without trying, if you have new or persistent pain, if something feels off, you should absolutely get it checked. Diagnostic testing for active symptoms is still crucial at any age. What we're talking about here are routine screenings that offer minimal benefit after a certain point. Knowing the difference can change the course of your senior years for the better. You also have the right to ask questions. Before agreeing to a test, ask, what will this test show? What happens if it's positive? What if it's negative? Will the result change the way I live or the treatment I get? What are the risks if I don't do this test? These are the kinds of questions that help you stay in control of your healthcare, instead of being swept along by a system that treats everyone the same. A lot of seniors feel pressure from their family members to keep testing just to be safe. It often comes from love and concern. But safety doesn't always come from more data. It comes from understanding, respect, and a focus on well-being, not just diagnosis. Conversations with loved ones about what matters most to you: staying at home, avoiding hospitalization, spending time with grandchildren, being pain-free. Those are the goals that your medical care should support. Another thing worth mentioning is how all of this ties into mental health. Older adults are at risk for anxiety and depression, and constant medical testing can intensify those feelings. The stress of waiting for results, worrying about follow-up procedures, or facing medical bills can slowly chip away at a person's peace of mind. A calmer, more focused approach to health, one that avoids unnecessary screenings, can actually reduce this mental burden and improve your emotional resilience. That kind of care is just as valuable as any prescription or lab result. We're not saying all screenings are bad. In fact, some should continue based on your individual risk factors and personal history. If you have a strong family history of a certain cancer, or you've had previous abnormal findings, continued monitoring may still be important, but the key word is individual. After 70, medicine should stop being automatic and start being personalized. There is no one-size-fits-all anymore. And finally, one of the most overlooked reasons to be cautious with testing in older adults is what happens when those tests accidentally find something unexpected. Doctors call these incidentalomas, incidental findings that look suspicious but usually aren't harmful. These show up on CT scans, MRIs, and other imaging tests done for other reasons. In younger patients, it might be reasonable to investigate further. But in older adults, chasing every abnormal spot or shadow can lead to biopsies, surgeries, or anxiety that wasn't necessary in the first place. And more often than not, those findings turn out to be harmless. Yet the patient has already been through a medical roller coaster just to get to that conclusion. So here's the takeaway. Health after 70 should be centered on living well, not just checking boxes. It should be built around how you feel, what you want, and what truly improves your life, not around blind routines or automatic screenings that don't offer real value anymore. It's okay to say no to tests that won't change your care. It's okay to prioritize peace of mind over protocol, and it's okay to let go of the fear that doing less means you're doing worse. Sometimes, it's the wisest and healthiest choice of all. If you're unsure whether a test is right for you, talk to a doctor you trust. Bring a loved one to help you ask the right questions. Focus on your goals, your values, and your quality of life. That's how you take control of your health in your 70s, 80s, and beyond, with intention, clarity, and confidence. If you found this video helpful and learned something new today, don't forget to like and share it so more seniors can benefit too. Make sure to subscribe to our channel and tap the notification bell so you won't miss any of our future videos on senior health and wellness. Thanks for watching, and we'll see you in the next one.